Western Mass News is your vaccine authority. A new survey found it may take longer for certain populations to reach a safe level of immunity from COVID-19.
Western Mass News reporter Stacy Circusoon is getting answers, finding out how communities of color may be more hesitant to get vaccinated.
I felt like it was designed for minorities to get tested in the first place, just to see if it was okay for other people to take it.
The COVID-19 pandemic has hit communities of color particularly hard, but studies show some minorities are still hesitant to get the vaccine despite high infection rates. Western Mass News spoke with Director of Survey Research from UMass Boston, Lee Hargraves, whose team surveyed 947 Massachusetts residents to find out how they really feel about getting the COVID-19 vaccine.
We basically said, if the vaccine was available today, would you get it?
When they focused on 25 different neighborhoods in the Bay State, 1 in 5 said no. Then, researchers broke down responses by race.
If you look at white non-Hispanic people, it's about 1 in 10. Hispanics, about 1 in 3. And black people, it's about 50%.
Hargrave says the hesitancy comes from much more than just distrust.
It's past injustice and inequity and harm and unethical behavior that black people know about.
Now, there are a lot of examples of research studies conducted on people in minority communities without their full consent or knowledge.
I think people are still scared from the history of clinical trials.
During the 1930s, the Public Health Service in Alabama conducted the Tuskegee study of untreated syphilis in the Negro male. The men involved in the study agreed to be freely examined and were promised other benefits. However, there is no evidence that researchers informed them of the study's real purpose, tracking the deadly illness's effect when left untreated. In fact, the men were deprived of treatment when penicillin became available in 1947, midway through the study that would last until the 1970s.
We think of it as ancient history, and maybe for some 1970 is ancient history, but for me it's not. In my lifetime, they were still doing experiments on people.
A cancer cell study also faced criticism on its research after using samples taken without consent from Henrietta Lacks, a black woman who died in 1951.
For generations now, without her permission or knowledge, and they made people have made money, and her family got nothing.
And as a Latina med student, Carolina Gonzalez explains, it's not just past injustices, but current disparities that some people of color face while seeking medical attention today.
They don't always feel like they're being listened to, like they're almost like dismissed. They're not always believed when they say that they're in X amount of pain. They think that they're just being drug seekers. This is why you see like a lot of these chronic diseases being passed on from generation to generation because they're never fully, truly assessed to their full extent.
When it comes to gaining trust back in all communities,
I think just the research and the study and the data says it all. And trying to break down that data into like digestible form for all people from all backgrounds.
Hargraves adds that representation is key.
I love Anthony Fauci. He's a great guy. He looks good on the television, but he may not be the best spokesperson to the African American and the Latinx community and others who are, a little bit more hesitant.
Which highlights the importance of a recent push for change.
When one talks about the movement called Black Lives Matter, it's stuff like that that makes that such a great slogan, because there was a time when that didn't seem to be true.
For Western Mass News, I'm Stacy Circusoon.